So we have some FDA-approved drugs, all right? These are usually pills, or in this case, there's a patch. Now these were first evaluated among older adults. They were never fully tested among people with Down syndrome. Since the last drug was approved in 2003, since then, over 120 drugs have come to the phase 3 clinical trials. These are research trials involving literally thousands of humans, and they agree to randomized controlled trials. So some people get placebo, some get active drug, and when all is said and done, none of these drugs worked that have been tried since 2003. And the reason we're trying to build upon these drugs is that they only work probably in 25 to 50% of the cases. And the last time I talked to Dr. Kuhn, he was really no fan of these drugs because significant side effects. And he did not think, and maybe he still holds to this way of thinking, right, that the benefits are outweighed by the side effects. These drugs only work in about, a minority of people. So if they're going to cause diarrhea and constipation and nightmares and changes in behavior, like, what is the point? So unfortunately, these are not quick fixes. They don't stop the progression. They don't reverse symptoms, right? They may stabilize or improve symptoms for some people for some time. Now imagine you had, chronic headaches, and I said to you, here's a pill that might work 25 to 50% of the time, and it just might take the edge off of it. That's sort of where we're at in the development of drug treatment for Alzheimer's disease. Okay? And I know a lot of people are dissatisfied with these drugs, so they will seek out alternative treatments. If you Google coconut oil and Alzheimer's disease, you will see amazing videos. You will see web pages devoted to, these wild claims about the benefits of coconut oil, and I've heard it all. Hyperbaric chambers, you name it, I've seen it. All right? Don't believe any of that stuff. I'm very troubled by the current ads on TV for something called Prevagen. Have you seen that? Mm-hmm. Yes. Supposedly it derives its key ingredient from, what is it?
Something from the sea,
Yes, some sea creature. Jellyfish. Thank you, apparently. Thank you, right? Anyway, this has not been tested. It's a bunch of snake oil, all right? Stay clear of such stuff. I don't know how the government enables these kinds of products to be sold with all these false claims. It really is criminal. Because understandably, families are desperate for something that may work, and unfortunately, these things just don't work.
I think there's been some experience here at the clinic with Namenda.
Namenda.
If it's done very early. There have been some
success.
Yeah.
Yeah, and I don't want to take away from the success that some people see with this, right? Because
we tried that and it was terrible.
Yeah.
The side effects.
The side effects.
Yeah.
People have had that,
Anxiety.
and other people have said it may
Crying.
Right.
Yeah.
So it's hit or miss,
Right.
right? So I think most physicians will say, well, let's try it, right? Let's try one or the other. And you could even try this combination, which combines Namenda and Aricept, and see what happens, right? But I'm afraid families are really in a dilemma here. I take a drug for cholesterol. And the way we know cholesterol drugs work is by doing a blood test, right? You get that bad cholesterol number, and you take the drug, and then you have your blood tested again, and you see the numbers drop, right? That's the sign the drug is effective. Unfortunately, with these drugs, we've got no clear way of measuring success. And so I'm afraid it puts families in this uncomfortable position of saying, well, maybe he would have gotten worse without the drug. So we're going to hedge our bets and give him the drug anyway, right? It's just not a really good scientific way of measuring success. So that's why the drug companies are looking to improve upon these drugs. But again, it goes back to the complexity behind the biology of the disease. And until we solve that major riddle, we're not going to really improve upon these drugs. That's why all this focus is on prevention and reducing risk today. Okay? The drugs that are too often prescribed, in my humble opinion, are psychotropic drugs. You might be familiar with some of these classes of drugs, right? Antidepressants, anti-anxiety drugs, or anxiolytics, and antipsychotics. Now, antipsychotics were first developed for people with psychosis. People who had schizophrenia, bipolar disorder. These can be very effective drugs in treating many of the symptoms of those disorders. However, they have been used all too common to control the behavior of people with all types of dementia. They were never tested among older adults exhibiting verbal agitation or physical aggressiveness. They were never really tested among people with Down syndrome. And I'm afraid that sometimes clinicians are quick to prescribe this, and it has the effect of snowing people under. These drugs have highly sedating qualities to them. And that's not my definition of quality of life. Now, that might improve the quality of life for caregivers who are upset by this individual's behavior, right? But the behavior, such as combativeness, may be due to a number of reasons, and that's why I say we have to look for the root causes of behavior, all right? So let me give you an example. Let me pick on this gentleman. What is your name, sir?
Dale.
Dale? Dale, imagine you had Alzheimer's disease and you were no longer able to bathe yourself. And I came along to you one day and said, Dale, let's get you out of this clothes, man. What's Dale going to do? Anybody's going to resist, right? In fact, what does my behavior say to Dale right now? What does my behavior say?
Go away.
I'm threatening him, right? Right? I'm in charge. I'm strong. You're weak, right? And any self-respecting man would say, get the hell out of my face, buddy. And if you don't go away, I'm going to punch you. And Dale, normally being a mild-mannered man, maybe he does hit me or he cusses me out, right? And I might say, you know what? Stop that. And if you don't stop it, I'm going to get the doctor to give you one of these drugs. But who started this mess? Me. Maybe I should have been sedated first, Dale, before I punched you.
Another wine.
That's right. And a glass of wine, right? So what I'm getting at is sometimes it's all in the approach, right? That people with good intentions, sometimes will intervene in ways that others find distressing. All right? So we got to be very cautious about introducing these drugs prematurely or at all. All right? We can't overlook the fact that maybe somebody is having a pain issue. Particularly among our older adults. Anybody here have arthritis? Anybody? Right? Do you take anything for your arthritis?
No.
No? Anybody?
Red wine.
Red wine. Seems to be a theme here in this room. Right? But some people need some medication, right, to control their pain. And if you've ever been in pain and it wasn't treated right away, what does your mood or behavior look like?
Depression.
Right?
Depression.
We get depressed, withdrawn, or we might get irritable, cranky, right? Bothersome. And so people with dementia may be lacking the words to say, I think I need pain medication, instead act out their distress. So we always have to figure out, is there something physical going on? Is it a urinary tract infection or a UTI that's at work here? Instead of blaming the victim, looking for triggers. So I tell our caregivers at All Trust Home Care, we got to be good detectives. because oftentimes people cannot tell us on their own what's happening. We got to figure out better approaches.